Hi everyone, I'm Dr. Diane Hayden, publisher of Natural Nutmeg magazine, and welcome to our weekly podcast where I interview our expert writers and contributors on topics ranging from natural medicine, nutrition, green living, spirituality, and how to live a healthier, more holistic lifestyle. I am excited to have with me today April Beaman. She is a medical thermographer certified by the Professional Academy of Clinical Thermology and a professional member of Breast Thermography International. April has worked in the wellness industry for over 15 years and provides thermography screenings and wellness support for both men and women of all ages. And she is the owner of CT Thermography right in Farmington. So thank you so much for being with us today, April. How are you?
Thank you so much for having me. I'm doing great. How are you doing?
Awesome, awesome. I'm good. Um, I usually like to start these out by getting a little bit of background on you and your passion and how you even got into thermography. And I know that some people may have not even heard of what that is. So we're certainly going to explain that. And we're actually going to go through, I actually had thermography done for the first time last month. So we are going to go through my scan so people can see, in a real world example what that is. But let's talk about you. Let's tell us, how you came across this and what you were doing before and how you got interested in being a thermographer.
Well, this becoming a thermographer was something that I was not ever looking into because just like you mentioned, I myself had never heard of thermography before. And it wasn't until I started doing some research on a safe breast screening method that I came up with thermography. So I started looking at it for my own breast health and started to note where I should go, what I should look for in terms of the imaging and the facility I was going to. And a little time had passed after that, and about a year later, actually, and I was approached by a thermologist, and he knew we had mutual friends, and he knew that I was a holistic biological dental hygienist. And he wanted to get my opinion on implementing thermography into the dental setting, being that we do oral cancer screenings and we also check our patients' thyroids when they're there by palpating that area, feeling around. And I thought, wow, that's really interesting. So I started to do a little bit more research on that and to see if that was even something that could happen. And I had two girlfriends that were diagnosed with breast cancer, and they were both in their early 30s, and they were both diagnosed 3 weeks apart from one another. And it just was an aha moment. And I
Mm.
thought, okay, this keeps coming back to me first personally, because I was looking at it for my own health, and then professionally, and then personally again with having friends being diagnosed. So that's really how it started. I thought this information is out there, but as women, we're not aware of it. And I feel if my girlfriends had known about breast thermography, that their outcome of breast cancer would have been much different than it was.
Yeah, I
So,
mean, we hear stories like that all the time. And I
yeah.
think that many people you have a great article in our issue right now, our January issue, on what's the difference between thermography and getting a mammogram. And I think there's a lot of people out there that well, it may be misinformation, or they're just, I don't want to get a mammogram every year, and concerned about, you know, things that they hear about it, and lots of confusion. So one of the reasons why I wanted to do this podcast was to have you explain, differences and things like that, and then actually show people, what it is. What is thermography?
Yes, absolutely. I think, well, pictures speak 1,000 words. So it's, seeing what the images are and what they're looking for, I think is a great thing. So I really appreciate you sharing your scan and your images with the community. So,
Yeah, absolutely. Just to touch quickly on, let's talk a little bit about what is the difference between a mammogram and thermography. How would you explain that?
well, I always say, first of all, it's like comparing apples to oranges because they are two different types of screenings. One, mammography is going to use an X-ray, which is looking at the internal structure of the breast. Of course, we know X-rays are utilizing radiation, and a mammogram uses compression. So it's compressing the breast between two plates, and the X-ray is going to image through the breast to see if there's any type of structure that's formed, whether that be a density, a cyst, a nodule, or even cancer. Thermography is different because it's not touching the body in any way, and it's using an infrared camera. So if you think about it, it's kind of like a thermal camera. It's looking for heat. And we know that heat can be associated with disease or inflammation, and inflammation is typically the start of disease. So we're trying to find an early stage of change in the breast. So that is one big thing, the difference between the two, because mammography is looking for an anatomical structure, which is something that's formed.
Right. So it's already there. That's the
It's already
difference,
there.
right?
It's
Yeah.
already there, correct. And thermography is looking for those changes that happen, and that usually happens before a structure forms. And of course, there's no radiation, there's no compression like I talked about before. So those are the two biggest things, but they really are looking for different things.
Right. Well, I mean, what I love when I learned about thermography is the fact that this is information that you have that now you can do something, change your lifestyle, change your eating habits, whatever it might be. We're going to talk briefly about some things you can do. And then we just talked about this. I actually want to do a whole other podcast with you explaining, okay, now we have our results. What do we do with those? Like, what are steps we can take to make sure we don't go down this path? So, because I forget, you'll know the numbers better than I do, but I remember reading some things where basically by the time a mammogram is going to pick up something, you've potentially already had this growth or whatever it is for years, right?
Yes, years. And really, those years can range anywhere from 5 to 10 years. And that is because a cell is going to start and it's going to form and it's going to become awry. And those cells double on average about every 90 days. And so it takes that many years for that cell to then have many cells that form to about the size of an eraser head or a pea, which is typically what's seen on a mammogram. And that is, of course, if you don't have dense tissue, because if you have dense tissue, that does lower the effectiveness of mammography because the x-ray can't get through the breast. It can't see through the breast because it's so dense, because they're looking for a density. So I like to say it's like looking for a snowball in a snowstorm. They can't see it. And that's why most women are familiar with, if they have dense tissue, they have to have an ultrasound following because they need something else to correlate the findings in the mammogram.
Right, exactly. So this I love because, like I said, you think about what you could do in your lifestyle in 5 years, not even let alone 10 years of
Correct.
changes that you can make if you see that there is inflammation, heat, all those kinds of things. So, I just think it's something everybody should be doing as a preventative measure. Why not?
I think so too. And especially because it's non-invasive, it's not hurting the body in any way. It's not subjecting the body to radiation. So, and it just provides you a picture of your health that you wouldn't have had any other way. And really, a lot of my clients feel empowered after they see their first screening to make those positive changes to affect lifestyle, which is huge. We know that really nutrition and lifestyle habits is what can change your destiny.
Oh, absolutely. Yeah. Yeah. I mean, and me too. And I feel like I'm a pretty super healthy person. Yet there are some things that we're going to look at and talk about that I'm like not super concerned about, but I'm looking at it from the perspective of, okay, there are more things that I could be doing. So,
Absolutely.
yeah, absolutely. No matter whether, you think you are extremely healthy, there might be things that, are going on, as we know, in our body that we don't feel, so we don't really notice.
And I think that's a good point that you bring that up too. And some people might be scared to get that information and to get the information of, okay, what's going on? Maybe it's better that they don't know. But if you have an early sign that something is happening in the body, then you have the ability, like you said, to make those proactive changes to affect your body positively. So it's really all about that, is just getting that information so you know what's going on now.
Right. Exactly. Awesome. So do we want to take a look at my report?
Sure. Yeah, absolutely. So let's pull up on the screen the report. And again, Diane was so graciously offered to do this, which is awesome. So what you're looking at right here is Diane's report. And in our report, you get the full report of your findings, as well as all of your images are all attached in one report. It's in a digital format, so it's in a PDF that's sent. And the really nice thing, which I'm sure Diane can attest to, is that when she received her report, she didn't just receive it and never heard from me again. So that's one of my big things. My previous life as being a dental hygienist, education was a huge thing for me, and always educating people on how to keep their mouth healthy and their overall health healthy through their mouth. And so the big thing for me is to educate people on their health, breast health, overall health now, and also to know and make sure they understand the report when they get it. So they're not just getting it and then going, okay, I don't know what to do next. So Diane and I went through this report in full detail. So what you're seeing here is her information that she filled out, and then the written findings are listed all below that. So it breaks down breast and then the rest of the body. And then her images are connected here.
We should probably tell people that there's different
Oh,
scans, I guess,
yes.
that you could do. So I chose to do what is it called? Upper body
Upper
first.
body health screening.
Okay.
Yes.
Yep. Where you
So
you can just do breast, right? And
you
then
can.
okay.
Yep. So we offer 3 different types of screening. So we offer breast only, which is looking at the breast, the chest, and the axillary region, which are your armpits, which is very important because most breast cancers are found in the upper outer quadrants of the breast, which is close to the armpits. We also offer an upper body, which is a health screening, and that includes the breast, but it also includes your head and neck. So we're looking at your thyroid, we're looking at your mouth, we're looking at the blood flow of the carotid artery, we're looking at the abdominal region, so the organs that are obviously in the abdominal region and the back and spine. And then we also offer a full body, which is everything I just discussed, including the extremities. So hands, arms, legs, and feet. So Diane did chose the health screening, which was the upper body. So, which is a great thing, really, honestly. I usually encourage people, if they don't know where they want to start, I usually encourage people to start with that half body because there's so much information that you're gaining, and we know that we're more than just our breasts. So I have seen many people with something going on in the mouth that's trailing down the breast. Sometimes it's going into the thyroid, sometimes it's going into the breast. So it's always good to get that information, especially for your baseline. So let's talk about the images quickly. So what you're seeing here are 2 images, and they're the same image or just in different color palettes. So the image to the right is known as the inverse grayscale imaging. And we take our images in this palette and we supply this image for our clients to see, because this is how our doctors are monitoring and evaluating the blood vessels in the breast. And this is a very important thing to know. Of course, we all have blood vessels in our breast, we should. And some women are highly vascular, some women have no vascularity at all. Everybody is different, but it's unique to you. And these patterns shouldn't change over time. They should stay very stable. And what we're looking for is a change in terms of pathology. So there is a phenomenon that happens in cancer. It's known as neoangiogenesis, and that's simply the formation of new blood vessels. And those new blood vessels form to support the growth within the breast. If there is some type of metabolic or cellular activity, meaning the cells are doubling over time to create cancer, you need a blood force to come to it. So you have new blood vessels that form. But those blood vessels are not normal. They really look abnormal, and they also supply an abnormal amount of heat. So we look for 2 things in thermography. We look for patterns of temperature or heat, and we also look for blood vessel. So the black and white image is depicting that. So you're going to see some darker areas here in the breast portion and even up in the upper chest, and those are the vein patterns. And what you're going to see here is this is symmetrical. We should see that it looks even on both sides. We won't see that it's identical, but we will see that it looks even. So in terms of the blood vessels here, our doctors were feeling that these were very normal blood vessels for Diane, which is good. That's one of the things we want to look at. The second image, the rainbow color palette, which is what most people are familiar with thermography, because they know that when they see colors, colors are going to indicate temperatures. So blue is cold, red is hot. And I always tell people, just because you see red in your images doesn't mean this is an area of concern. Now, if we go back to where these blood vessels are in the black and white images, there's blood flow there. And that's normal to see red and heat there because there's normal blood flow. So you're going to see those areas are going to look hotter wherever those blood vessels are. Now, our doctors are also going to measure temperatures. Again, wanting to be symmetrical, we should see that the temperatures are pretty much the same on both sides. So these circles are indicating where our doctors are measuring temperature. They always look at the whole breast and they measure the temperature between the both, and they want to see which breast is warmer, if any, than the other. And then they're also going to look at the nipple area and maybe some focal areas. So you're going to see that our doctors took a few measurements here throughout where those blood vessels are and were for Diane. So this is the first image that we take. This is an anterior image, so it just shows us obviously the breast, chest, and axillary area on the front aspect. And then if we go down to these next two images, this is considered an oblique image. So this gives us a better view of the armpits, the axillary tail, which comes in from the armpit into the breast. It gives us a better view of the side of the breast, another view of the nipple as well. And again, what we're noting is symmetry. So the one thing that our doctors looked at is an area that showed more heat, which was here in the upper outer quadrant of Diane's right breast. You can see where I'm circling, there's actually a number here, and there's a number here, and you can see there isn't that vascular pattern there. So our doctors are looking at this, and they want to see what that looks like next time. So this is an area that doesn't look the same on the opposite side, and so that's why our doctors are looking at that. So Diane and I reviewed that together. And then these images are the lateral images. And again, it just gives us another view of the side of the breast, the armpit area, and going all the way down the side of the body. And you can see she has pretty much the same amount of heat on both sides. So what I spoke to Diane about was some self-care routines that she can do at home to easily help improve her breast tissue and maybe even detox that area a little bit better. So we went through a couple of those things because you can see here, it is a little warmer again on the right side. This is that one area that our doctors were looking at. And then there's another area of vein patterns that our doctors were looking at. So we want to work this area to improve it for the positive for Diane. So she's implementing a couple of things that I spoke to her about. And then the last image that we take for breast is looking at the inferior portion, so the underneath side of the breast. So Diane's lifting each breast one at a time in these images, and then I always do an image with her lifting both breasts up at the same time. So we really get a clear view underneath the breast too. And really, the one thing I didn't mention, I'm sorry, Diane, I know you were about to say something. Do you want to
That's
say
okay.
something and I'll go
Well, you're
through?
probably going to say it, but I'm just going to say that we talked about the fact that I obviously have no heat patterns on the underneath because my breasts are on the smaller side, and um I don't like sweat a lot under there. Sometimes I do wear, we talked about the tight sports bra. I
Mhm.
exercise all the time, so I am in a sports bra a lot, and maybe not wearing one that had such a tight band all the while, just using that strictly for when I'm going to exercise and then taking it off and putting on something that was a little looser fitting. But I think if women do see red under there, I just wanted you to talk about that a little bit. That doesn't mean that that's a bad thing. It just may mean
Yes.
that they have larger breasts that are, that create more heat because they're laying on the skin essentially.
Absolutely. And that's why I always tell people just because you see red in your images does not mean that it's bad. There's several reasons why that can be. Of course, our doctors are going to measure all those points of temperatures, and those are areas that we'll look at and they'll look at going forward. But if we see areas like sometimes the armpits are hot, right? It's a cavitation. It's normal to have some heat in there. But if I see there's a lot of red in the armpits and trailing down the side of the body, I know that woman is probably wearing antiperspirants, and antiperspirants block your way to sweat. And that's not ideal for the lymph nodes that are clustered in the armpit and then leading into the breast. So those are a couple things that I talk about with my clients, changing those lifestyle habits to make positive changes for breast health. So yes, everything you see is not an issue if it's red. Diane does have some slight heat here, not too much here, but what we talked about was changing the tight constrictive sports bra, just to make sure there's more lymph flow there.
And do
So,
you have a favorite deodorant that you like, a brand?
I will tell you that I like to make my own. So I tend to make a deodorant that has baking soda, which neutralizes odors, and I utilize coconut oil and some essential oils as well. So I am one of those people where I like to know what my ingredients are made out of and that there's very little. But if you're going to go out and buy a deodorant, I always tell people, first of all, if you're using antiperspirants, please get rid of them. This goes for men too. There's aluminum in the antiperspirants, and that is a metal that's going directly into your skin, which, by the way, is your largest organ. So you don't want to put any type of metals into the body. I will tell you, when they biopsy breast tissue, two things that they find are plastics and metals. So we want to really be mindful of those two things. But so get rid of the antiperspirants. And then if you're going to go with deodorants, always look at the ingredients. The shorter the list, the better, just like with your food. And try to do organic if you can. I tend to like a deodorant that has either charcoal or baking soda in it, because those two things really help neutralize the odors for people.
Right.
So I like Schmidt's. Schmidt's is a great brand. Native is a great brand. And now, honestly, you can go to many places to find natural deodorants, especially, like your larger natural stores like Whole Foods and things like that.
I think the reason why both men and women still use antiperspirant slash deodorant, I mean, first of all, if you're buying anything that's, commercial or whatever, it's all going to be antiperspirant deodorant. They've been combining that for years. But I feel like the people who I've talked to try to get them off of that, the biggest complaint is that I sweat under my armpit. I'm going to have sweat like running down my side. I know people who are watching this are thinking that. So I'm like, I'm just going to bring it up because I know there's somebody saying that. So
I love that you brought that up. And actually, the article that I wrote for the next edition of Natural Nutmeg has just that information in there, talking about a couple things. So yes, I do agree, because that's one of the biggest complaints with my clients. But sweating is a natural occurrence. We need to sweat. First of all, we have to detox the chest and breast area. And if you are blocking your way to sweat, you're blocking that detoxification pathway. So it's not ideal to do that. So sweating sometimes, yes, is a hard thing. So I always tell people, try different deodorants and see what works better for you. You'll probably still get a little bit of sweat there, but just keep in mind, sweating is good. It is something you are supposed to do.
right. Yep. I think it's just a matter of changing your mindset about it,
It is.
I mean, like, I don't mind sweating at all when I'm exercising or whatever. If it's a hot day, you know that you're going to be sweating. I think the problem for some people is, like, oh, I'm all dressed up, or I'm at work, or whatever it might be. And
Yes.
yeah, I mean, I think it's just a matter of just changing the mindset around that.
I think that you're absolutely right. And some of the deodorants really have been helpful for people, even if they are sweating more than with an antiperspirant. They'll notice that some work better than others. So it's like trial and error. You just have to figure out what works best for you. That's why I like what I make for myself, because I know that it works for me. So that works. All right, do you want to go quickly through the rest of this so everybody can see what the image is? Okay, so this first section was purely just breast, and with Diane having the upper body screening, we image her head and neck. And there's a lot of information in the head and neck. And one of the things I think that a lot of people are concerned with too is thyroid. And especially for women, right? Thyroid is going to regulate your hormones. You want to make sure that that's functioning properly. And that could also lead into maybe a liver issue too, if we're seeing something going on in the thyroid. So with head and neck, what we're looking for here is thyroid, dental, and we're looking at the blood flow of the carotid artery. So we're measuring an area that holds smaller arteries that branch off from the carotid artery, and those are located on the forehead. So you're going to see 2 circles on the forehead, just like you did for the breast. And that's, again, how our doctors measure the temperature. Nose is always cold, so that's why it looks black. And really what you're looking for in terms of the image and the color is that things are equal on both sides. So the cheeks are blue. That's pretty typical to see that that's cold. Now, Diane did have some heat around her mouth, and what you can see is that it's generalized, and she has a little bit more heat on the right side of her mouth. So what I talked to Diane about is, previously being a dental professional, is a habit of clenching or grinding, or does she wear a night guard? And that's typically an indication that, yes, you do something like that. Your dentist would make that appliance for you to stop that habit. So we're seeing there's more heat on the right side. She's more likely applying more pressure on that right side of her mouth, and that's stressing the muscles in that particular area and showing more heat. Now, sometimes when we look at images for dental, I can see pinpoints of hot spots. Diane doesn't have that, but I'll ask the client, do you have such and such going on in your mouth? Do you have periodontal disease? Do you have gum disease? Do you have bleeding when you're brushing and flossing? Do you have any root canal teeth? Do you have any silver mercury fillings in your mouth? So all of that can be relating, because it does look for underlying dental pathology. It's not always going to give you the exact tooth number, but with me being a dental professional, I'm usually pretty well equipped to let people know what's going on and where it is. So that would be just the frontal section of head and neck. And you can see we take several views of that. And then we do a thyroid image, so a little closer onto the thyroid. Now, Diane does have some heat throughout the neck, and it's pretty common to see heat along the sides because this is where the carotid artery is, and there's always a lot of blood flow there. So if we didn't see heat there, that might be an issue for Diane, and she probably wouldn't have walked into my office. But we are looking for heat around the thyroid. And although there is a lot of heat throughout, this could be relating to some lymphatic congestion. So we talked about that with Diane, but our doctors pinpointed the right side is showing more heat around the thyroid than the left side. So there's more of a little bullet point there than anywhere else. So this is something that, she would want to talk to her doctor about, possibly doing some blood work just to see the function of her thyroid. So it's going to provide both you and your doctor with information that this area might need some further investigation. So that's what head and neck information would give. And then we look at the abdomen. So Diane does have some heat throughout, and it looks pretty even on both sides, although we saw a little bit more heat in the bottom. So this is when I asked her, do you have any acid reflux? Because sometimes we'll see heat in that specific area, and she does not. So this could just be a normal heat pattern for her, and that's the things that we look at each time that we do a screening. You're seeing some vein patterns here in the darker areas. And the other thing that I would mention, and I did mention to her, is you see these little tiny dots that are in the abdomen, and this could be indicative of hormonal imbalances or fluctuations. So we talked about that with Diane, because thermography looks at several things, and this could be another thing, again, talking to her doctor about that. And then we also take images of the back. So this is an image where Diane's bending in front of the camera, and we do this so that I can get a better view at the top of her shoulders, which is where my cursor is going, and this is the back of her neck. This is her hair. Her hair is very cold because there's no blood supply in the hair itself, so that's why it looks very cold. Black, it would be the coldest color. And then the back of her, this is her spine going down. And then when we go to her actual back, you can see here that probably because she works out so well and she does a lot of lifting, that she's got a lot of heat in her back. And this could be musculature, but this could also be part of the spine. So if we're seeing some heat, our doctors might recommend a chiropractic evaluation or seeing a physical therapist, depending on what's going on. And then this is the lower portion of her back. And you can see there's not a ton of heat. The spine usually has some heat in it, but the lower portion of the back does not look so hot as the top. And then this is an overview of the whole half body. The other thing I will say about this too is that we have seen people that come in and they have some localized areas of heat. Even if it's red in one particular part of the back, we'll see like a bullet point again, somewhere specific that's kind of standing out. So our doctors will recommend a consultation with a dermatologist. So this could be a good skin cancer screening too, as well. We've seen people actually with melanoma. I took one image of a woman who her back, when you looked at her back clinically, it looked completely normal. She had a couple freckles, but nothing major. She was fair skinned. And when I took her thermogram, that's what made me look at her back naked. But when I took her thermogram, I was like, wow, there's definitely some heat there. And she ended up having melanoma. And on the surface of the skin, you could not see it at all. Wow. It was crazy because that's not typically the case with melanoma.
Right. Yeah.
So
see, there you go. Now you can come see you before you even go to your dermatologist.
Yeah, because usually the dermatologist takes like a year to get into.
Well, and not only that, but it's also just like a mammogram. You're not catching it. You're not seeing something until you've already gotten the disease, essentially. And this is, wow, you could have 5 years, 10 years, maybe ahead of something developing by having this done.
Absolutely. And honestly, the majority of my clients are women because most people that are familiar with thermography know about it for breast thermography. But I have several men, and sometimes they're brought in by their wives or their significant others, but sometimes they're not. Sometimes the men bring their wives in, which is also great. We can also see children. And my youngest client is 21 and my oldest is 94. Wow. So I have like a range of ages for people. And really my passion is educating about thermography, but educating younger women, because younger women don't have a breast screening that's offered to them until they're about the age of 40. So why are we waiting until we're that age to start looking at our breast health? Because earlier and earlier women are being diagnosed with breast cancer now.
And I was also just going to say, why do we want to start giving them mammograms when they're 20 years old? I mean,
Correct. Agreed.
the
And
more, I
yeah,
don't know. To me, like I can come out and say it because I'm not a practitioner, but I'm not saying I don't believe in them. I think they have a purpose, but I don't agree with getting a mammogram every year. I think that that is way too, risky for that much radiation is way too risky for people. And that's just my opinion and my
mhm.
belief. So, you
Well, I
know,
will tell you, it's not just your opinion and belief. There's a lot of research on that. And that's why mammography has gone under scrutiny for several years in terms of that. It's not finding things any earlier. It's also subjecting the body to radiation, which we know is a known cause of cancer.
right. Which
So
which there in itself right there, it's like, okay, wait, we're using a screening tool to detect cancer that potentially can cause cancer.
yeah, doesn't add up. I know.
No. But anyway, so yeah, I mean, it's great that it can be used for all ages. And of course, like there's no, like you said, there's no it's not invasive, there's no negative to it, there's no side effect, there's no reason why you wouldn't do this in my mind.
Absolutely.
So awesome. Well, this has been fantastic, very
Yes.
informative. I'm sure people love it, and I'm sure people are going to want to know how they can get a hold of you. So, any contact information that you want to give us?
Yeah, perfect. So first of all, you can always go to our website, which is ctthermography.com. There's a lot of information there. There's a lot of images. So please peruse through there. The other thing I want to point out is I am, as I talked about, an educator. So I do offer a lot of webinars throughout the months, and that usually includes 1 or 2 thermography webinars a month. So any of our events or webinars that I hold will also be on the website. So that's good. The number to reach us at is 860-415-1150. We have 2 offices. One, our main office is in Farmington, and we have a satellite office in Glastonbury for those that don't like to travel back and forth over the river. And then you can also email us at info@ctthermography.com. So lots of ways to get in touch with me.
Awesome. That is fantastic. And this podcast will live on our website at naturalnutmeg.com, and we'll be e-blasting it out to everybody as well. So thank you again, April. This has been awesome and a lot of great information. And I hope that many people will be reaching out to you.
Thank you.
Awesome. Thanks, everybody. Have a great day.